parliamentlive.tv. parliamentlive.tv. parliamentlive.tv.
Order. Just before we come on to the next business, before calling the Shadow Health Secretary to ask his urgent question, I must draw to the attention of the House the fact that this urgent question on the coronavirus is being streamed live with accompanying British Sign Language interpretation. I think that means that people will have to be very careful what they say and how they wave their hands around during this important piece of business. Order. Urgent question, Mr. Jonathan Ashworth.
Thank you, Madam Deputy Speaker. To ask the Secretary of State for Health and Social Care to update the House on the coronavirus outbreak.
Thank you very much, Madam Deputy Speaker. Madam Deputy Speaker, the coronavirus outbreak continues to advance around the world. The number of cases in China and South Korea keeps rising, but at a slowing rate. However, the outbreak in Iran, Italy, Switzerland, and now France and Germany is growing. In Italy alone, we've seen 1,492 more cases overnight and 102 more deaths. Here in the UK, as of this morning, there were 319 confirmed cases. Very sadly, this now includes 4 confirmed deaths. I entirely understand why people are worried and concerned, and we send our condolences to the families. The UK response is guided by our 4-point action plan. We continue to work to contain the virus, but we're also taking action to delay its impact, to fund research, and to mitigate its consequences. Throughout, our approach is guided by the science. That is the bedrock on which we base all our decisions. Our plan sets out what we're prepared to do, and we'll make the right choices of which action to pursue at the right moment. The scientific advice is clear. Acting too early creates its own risks, so we will do what is right to keep people safe. Guided by the science, we'll act at the right time, and we'll be clear and open about our actions and the reasons for them. Madam Deputy Speaker, these are the principles that underpin the very best response to an epidemic like this. Turning to research, I can report to the House that we've made available a further £46 million to find a vaccine and develop more rapid diagnostic tests. We'll continue to support the international effort. Here at home, the NHS is well prepared with record numbers of staff, record nurses and record doctors. I want to thank all those involved for their work so far. The number of calls to NHS 111 has increased, and we've now added an extra 700 people to support that effort. 111 online is now dealing with more inquiries than the voice calls. To date, Public Health England has tested nearly 25,000 people, and the time taken to test is being reduced as we're bringing in a new system for faster results. But of course, responding to coronavirus will take a national effort, and everyone must play their part. Of course, that means government. It also means everyone washing their hands more often and following public health advice. But there is much more that we can all do, both through volunteering and through support for those who are the most vulnerable. We'll shortly bring forward legislative options to help people and services to tackle this outbreak. The bill will be temporary and proportionate, with measures that last only as long as necessary, in line with clinical advice. And I can also report that over the weekend, we initiated action to help 120 passengers on the Grand Princess cruise ship off the coast of California to assist them in coming home. Madam Deputy Speaker, we will stop at nothing to get this response right, and I commend this statement to the House.
Jonathan Ashworth.
I thank the Secretary of State for his answer. Our thoughts and naturally with the loved ones of those who have sadly died from COVID-19. We also want to put on record again our thanks and gratitude to our hard-working NHS staff and our Public Health England staff. Can I press the Secretary of State a little further on the response he's just given? He will know we've repeatedly called for an emergency funding package for our NHS. He will know we're short of 100,000 staff in our NHS. He will know that critical care bed capacity was at 81% for the week that the latest figures were available. The Chancellor has said the NHS will get whatever it needs. Does he agree that in this Wednesday's budget we need to see significantly more resources for the NHS, not just rhetoric? Scaling up and freeing up capacity in the NHS now is absolutely urgent. Can he tell us what is being done to scale up intensive care beds in the NHS? What work is being done to expand capacity to the oxygen and ventilation machines that will be needed? And can he tell us what the current capacity of ECMO beds is? We welcome the distribution of personal protective equipment across NHS staff, but does he agree that GPs and social care staff also need access to that equipment? For those in receipt of social care, they are some of the most vulnerable who could be really, really badly affected by this virus. And indeed, many who work in social care are low paid, and if have to go off on sick, has huge implications for the delivery of social care. What advice has been given to social care providers and indeed local authorities to ensure the most vulnerable are protected, and what plans are in place to protect staff and get more staff into the social care sector? Public health directors are expected to play a leading role in their local preparations. They need to make decisions about deploying staff. Public Health England has asked for staff to be seconded, for example. Yet they still don't know their public health allocations for the next financial year, starting in 3 weeks' time. We are begging the Secretary of State, please tell local directors of public health what their budget is for this coming April. We are still officially in the containment stage. At some point, we presume we will need to move into the delay stage where we understand social distancing measures will be necessary. Many of our constituents are now asking, and I think it would benefit the House if he could just explain for our constituents why we are not yet considering more home working. Should we be asking those over 65 to isolate? Should we be cancelling larger events? And should those returning from Northern Italy, for example, be taken to quarantine? I just think it would help our constituents if he just ran through the medical advice on those fronts. I understand why he's made the decisions he's made, but can he also confirm that once we move into the phase where measures of this magnitude are proposed, will the Secretary of State come to the House and explain why and allow members to question him? On the mitigation stage, he has hinted or suggested we'll need emergency legislation. As a responsible opposition, we would like to sit down with the Secretary of State to understand the content of that legislation, because we want to work on a cross-party basis. But let me leave the Secretary of State in no doubt. We also want statutory sick pay for all from day one. Asking people to wait 5 weeks for universal credit is not a serious solution. Could he update the House on food supplies and what conversations he has had with supermarkets? And can he reassure us that our constituents do not need to be panic buying, as we've seen on social media in some parts of the country over the weekend? And finally, does he agree that whatever happens, we must find a way for Parliament to continue to hold ministers to account, and so we can ask questions on behalf of our constituents? But we continue to offer to work constructively with the government, because the public health interest and the safety of our constituents must always come first.
Thank you very much, Madam Deputy Speaker. And I'll start by concurring with what he said about the legislation, because this should be taken through on a cross-party basis. And of course, I'll be happy to talk to him about the proposals in that legislation, and also ensure that the clinicians are able to explain why these are necessary and proportionate. And I'm grateful for the tone that he's taken throughout of this, recognising that we're led by and guided by the science in the responses that we make. He asked about the NHS and their preparedness. Of course, there are record numbers of nurses and doctors, as I said. The 8,700 increase in the number of nurses over the last year is welcome in this context. We are, as he said, scaling up intensive care beds and also making sure that we have as much availability of ventilation equipment and, crucially, the skilled and trained people to use it, because ventilation equipment without trained people is dangerous. And on the same subject, making sure that we have the oxygen that is needed in order to go into those ventilation kits, and working with oxygen suppliers to make sure that that is available. He asked whether GPs will get access to the equipment that they need, the protective equipment, and the answer to that is yes. We have stockpiles of protective equipment. We will release it. Again, we'll release it at the right time, and I'm working very closely with NHS England on making sure that that happens. He asked about social care, and he's absolutely right to draw attention to the importance of social care, both making sure that the staff in social care are well enough supported, including if they are sick, and critically, because many of the residents in residential social care will also be some of the most vulnerable people, and those living in the community in receipt of social care will also be likely to be vulnerable, whether with prior health conditions or because they're elderly, or both. And that is an area of significant attention, and we'll be updating the existing guidance that there already is. We'll be updating that guidance this week with further information for social care providers. He asked about public health budgets. Public health budgets, of course, are going up. He asked also about home working and the cancellation of large events. We are not at this stage proposing the cancellation of mass events, because we're following the scientific advice that that is not what is proposed at this stage. Of course, home working and flexible working is something that in many cases is advocated anyway, and people will make their own decisions as to when that is appropriate. What we are saying from a government point of view is that you should follow the public health advice, so that, for instance, if you're returning from an area that's affected and you have symptoms, then you should stay at home, and that means, of course, home working. We added over the weekend Northern Italy to the list of places that the Foreign Office does not recommend travel to unless except in exceptional circumstances, and therefore those returning from Northern Italy, we're recommending that they self-isolate if they are symptomatic. Two more points, Madam Deputy Speaker. He asked about the food supply. We are confident that food supply will continue even in our reasonable worst-case scenario. We have been talking to the supermarkets for some time about this scenario. I appreciate that on Friday there was discussion about whether every single supermarket executive had been involved in those talks. If any further supermarket executive wants to be involved in those conversations, then they should get in contact. But those conversations have been ongoing, and it is very important, especially as we ask more people to self-isolate and to stay at home, that we can ensure that we get supplies that are needed to the people who we are asking to stay at home. He asked about statutory sick pay, and I can confirm that we're proposing to put changes to statutory sick pay into the legislation, and I'm happy to go through with him the details in the talks that I mentioned at the start of my response. And finally, on Parliament, Madam Deputy Speaker, of course this is a matter for the whole House, and I know that the Commission met this morning. But what I'd say is I think that parliamentary scrutiny of decisions of the magnitude that we are having to take in response to coronavirus and the novel nature of them, that parliamentary scrutiny is incredibly important, and I will do all that I can to ensure that Parliament remains open.
Jeremy Hunt.
Thank you, Madam Deputy Speaker. Can I commend the Health Secretary for the way that he's handling this crisis and ask him to reflect on what we now feel that we have learned from the situation in China, given that yesterday was the first day when reported new cases in the UK exceeded reported new cases in China. The Chief Medical Officer told the Select Committee that he would hope that a smaller proportion of the population in the UK would get the virus, given what we can learn from what happened in China. But one of the reasons for growing concern amongst our constituents is that the only number out there is the 80% reasonable worst-case scenario. Is it not time for the Health Secretary to share his central estimate of what he thinks the proportion of the UK population is that will get this virus, even though we would all understand that that estimate may change over the passage of time.
I want to also pay tribute to the chair of the Select Committee for the way that he has handled this, the need for transparency and the questioning, for instance, of the Chief Medical Officer last week. I will take away the point that he makes on the need for a central estimate. The figures out there in terms of the proportion of people who will get it are a reasonable worst-case scenario. On the central estimate, there are still things that we do not know about the spread of the virus through China, and in particular, the degree to which the slowing of the increase in the cases in China is because the virus has reached a large proportion of the population, and there's a large proportion who are not symptomatic, which would mean the mortality rate was lower than otherwise, or whether it's that the very significant measures that the Chinese have taken are having a very significant effect, and therefore that as and when they are lifted, the virus will continue to spread. Either of those options is possible. We don't know which one, but whichever it is, the approach that we're taking in the UK is the right response to both of those scenarios.
Martin Day.
Thank you, Madam Deputy Speaker. It seems that we've had some media confusion that the move from a contain to a delay phase will be an instant flick of the switch moment. Will you assist in confirming that this is not the case and that any move is rather a phased transition? Another area of particular vulnerability is the UK prison system, which is extremely short-staffed and stretched. And what measures will he be taking following reports of deaths amongst the inmates and riots in Italy's prisons to ensure that the prisons remain under control during what will be a period of heightened tensions and frustrations at restrictive measures being introduced? And will he confirm that he is aware of the latest workplace advice from Health Protection Scotland, which was published today, which urges routine cleaning of phones and keypads and says food should not be left open for the people to share? And will his department be making a similar recommendations for England?
He's absolutely right that the transition to the delay phase is indeed that. It is a transition. We won't give up hope of containing this disease whilst we can still take containment actions, and many of the actions that are needed to contain it are also very effective for delaying. Of course, the prime of which is for everybody to wash their hands, but much more than that. He asks about the advice from the Health Protection Agency in Scotland, and we're working very closely with them, and Public Health England will be bringing forward further and updated guidance very shortly. That we've been working on over the weekend, not just on social care, as I mentioned earlier, but more broadly, including for businesses and employees and others.
Sir Oliver Heald.
Can I thank the Secretary of State for his statement? He'll know that in Hertfordshire the figures are now into double figures of cases, and that it's a county with some very large businesses with an international footprint, as well as many commuters going into London. Has the time come for discussions with these large businesses on how to reduce the number of international visits that are made, perhaps through teleconferencing more, and also how to allow more people to work from home when possible, and to try and just reduce the number of visits backwards and forwards which may be affecting the virus?
Well, an awful lot of companies are taking these steps, and other employers, and teleconferencing is both usually cheaper and also better for the environment than travel, and so there's good reasons to use it anyway.
Thank you, Madam Deputy Speaker. As my honourable friend's question and the Secretary of State's answer has made clear, parliamentary accountability on this is absolutely fundamental, as is evidenced by so many members on all sides of the House rising to raise a whole myriad of issues. As the Secretary of State himself has acknowledged, parliamentary accountability is fundamental, and yet we're hearing reports that the House might, after Easter, be suspended until September. Could he absolutely undertake that this is not going to be the case and recognise that we can play our part as a big organisation of 650 MPs and thousands of staff. We can play our part as an organisation in containment without going for the nuclear option of closing down accountability altogether, and that other measures could be considered, for example, using Westminster Hall and making it on a UQ basis so that we have absolutely continuous accountability for what the government is doing through this Parliament, albeit it might be in a different form.
Well,
Secretary of State.
I haven't seen those specific reports, but I do know that the Commission met this morning. And what I can say is that I think that parliamentary accountability is incredibly important, and I will be doing all that I can to make sure that Parliament stays open through this process, and make sure, of course, that we follow the clinical advice as to how we make sure that that can happen, but that we keep that parliamentary accountability. That's my position. This is a decision for the House, but my position and the government's position is quite clear.
The government is absolutely right to be putting a lot of public money into research into a possible vaccine, but he will know that research is no good unless you can produce vaccine at scale, and this country is not great at producing vaccine. What can he do to ensure that we grow indigenous capacity very quickly so that the UK public, and in particular key workers in our health service, do not have to wait in line when a vaccine becomes available?
This is a very important point. We do have some significant vaccine capabilities, and vaccine, not only the research where we are world class, but also some production, for instance in Hamilton in Scotland. But there is a broader point, which is that investment into the whole production chain, not just the research, is critical.
Liz Saville-Roberts.
The Government has outlined emergency legislation which will extend new powers to Welsh Government. When I speak to Council representatives, they are concerned that there are currently legal obstacles which hinder the swift deployment of emergency staff, including vehicle insurance and limits on working hours. I'm particularly applying this to social care staff, and there is a shortage in Wales and I believe across the UK. What discussions has he had with Welsh Government to ensure clear guidelines for emergency implementation in the care sector?
Secretary of State.
We've had ongoing discussions with the Welsh Government, and the Welsh Government, for instance, joined the COBRA that we held this morning, and in fact have been present at all of the COBRA meetings that we've had throughout, and we've had very good engagement on the bill. I'll look into the two specific points that she raises and talk to my Welsh colleagues about them.
Dr Caroline Johnson.
Thank you, Madam Deputy Speaker. And can I thank the Health Secretary for the way he's managing this crisis and for how frequently he's coming to the House to answer questions. Pregnancy is a time of great joy, but also in the context of the coronavirus can be a sign for great worry as well. Is there any specific advice from the scientist or the Chief Medical Officer for ladies who are expecting, or for those who might be considering starting a family?
Yes, I'm glad to say that the evidence is that the evidence so far is that there is not a particularly raised concern. Nevertheless, of course, somebody who's pregnant and who gets coronavirus, I entirely understand the level of worry that would create, and so we are researching it very carefully.
Hilary Benn.
Thank you very much indeed, Madam Deputy Speaker. A study of 52 critically ill patients at the Jin Yintan Hospital in Wuhan found that more than 2/3 required invasive breathing support. And last Monday, as the Secretary will know, the World Health Organization urged all countries to stock up on ventilators. Given that around 5% of those with coronavirus may require critical care, what is his current best estimate of the number of ventilators that would be required to meet that demand, bearing in mind the point he's made about, of course, having sufficient staff to operate those ventilators? But what is the number that we need?
Secretary of State.
Well, I'm very happy to write to him with the specific answer to the question. But the general answer, the point in the answer, will be the answer's more. and as many as possible, frankly. So we are buying ventilators, and we have a whole commercial strategy around that, and, of course, training up people to be able to use them.
Stephen Metcalfe.
Thank you, Madam Deputy Speaker. My right honourable friend knows that the long-term solution to tackling the virus is vaccines. Can he tell the House what work, in a bit more detail, what work is being done, the potential timings for new vaccines and home tests, and more importantly, will he keep the balance under active review between the efficacy and safety of vaccines and the public health impact they could have?
Well, this is the critical point about vaccine development for coronavirus, which is that if you can't be sure that a vaccine is safe, then for a disease with a mortality of around 1%, you can't put that vaccine into large numbers of people. This is different from a disease like Ebola, where the mortality rate at around 70% is so high that it's worth taking the risk. And this is a broader point about the response to this virus, Madam Deputy Speaker. It is very different to Ebola. It spreads in a different way, its mortality rate is very different, and so it is very important that we fight this disease, not fight the last war.
Thank you, Madam Deputy Speaker. The other day the Prime Minister said on morning television, perhaps you could take it on the chin, take it all in one go, and allow COVID-19 to move through the population without taking as many draconian measures. Can the Secretary of State advise the House that this is not the Government's official position?
Secretary of State.
No, it's not the position, and the Prime Minister was explaining why we've taken the decisions that we have.
Chris Grayling.
Thank you, Madam Deputy Speaker. This is obviously a really worrying time for our elderly population, who are, by all accounts, more likely to suffer badly from the disease. What advice would he, and indeed what advice would the Chief Medical Officer give to both the elderly themselves, their families and their neighbours about how best to protect them and what actions they should take to ensure they're not exposed to this disease?
Well, this is a really important point, and the advice now is, as for everybody else, to wash your hands and to follow the public health advice and to catch a sneeze or a cough. But we don't rule out changing that advice to advising measures that help protect either the elderly or more vulnerable people who have pre-existing health conditions, because an approach that treats them differently is appropriate given that the disease treats them differently.
I should just say to the House that there are a lot of people standing, and that we cannot really let this piece of business run much past 4:15. And so people are being quite brief, the Secretary of State's being brief, but I just give notice that not everybody will be called. Barry Shearman will.
Madam Speaker, can I just press the Secretary of State on this matter? Yes, it's absolutely very important that we follow good science, but we need good management. And are we sure it's all right having a national COBRA, but what are local COBRAs? Every community, every local authority has got to deliver, as it gets worse, has to deliver it on the ground. That needs partnership across health, about police, local authorities. Is he sure that is in train?
Absolutely. This is a national effort, and the national effort involves the government, the NHS, every single individual, and local authorities, local resilience fora, the local police. It is a national effort.
Sir Desmond Swain.
We have net figures taking account of recoveries. It's very alarming simply to be given cumulative deaths and cumulative cases.
Yes, very shortly.
Chris Bryant.
It's not just coronavirus and dealing with it that needs parliamentary scrutiny. The government can't continue levying income tax unless we have another Finance Act. The government won't be able to use emergency powers under the Civil Contingencies Act 2004 for longer than 28 days. So Parliament will have to keep on sitting, won't it? And he's wrong. It's not for the House authorities to decide whether this House sits or not. The only person who can table a suspension of Parliament is a government minister. So will he just rule it out now?
Secretary of State.
Well, as I said, we see no purpose for suspending Parliament, and parliamentary accountability is very important, as is the legislative power of Parliament.
Greg Clark.
Thank you, Madam Deputy Speaker. On the day that Carillion collapsed, all of the UK banks, through UK Finance, agreed forbearance on the loans and overdrafts of small businesses affected. Has COBRA obtained the same assurance from the banks in respect of businesses affected by the coronavirus?
Those sorts of discussions are going on, led by the Treasury and the Business Department.
Angela Eagle.
Thank you, Madam Deputy Speaker. There are millions of people in this country who live alone, and many elderly people rely on their relatives to visit them to keep them able to live in their own homes. This activity may well be disrupted if people either get ill or have to be isolated. How then will those vulnerable people who rely on outsiders to be able to live and have their food delivered and be looked after possibly cope?
Secretary of State.
This is an extremely important consideration, because in keeping people safe from coronavirus, we also need to support people to live their normal lives. And for many people, they rely on support from others who come to them, whether through social care in the formal system or in many, many cases, informal care and support. And in fact, we may need to see more of that, but it will have to be done properly to also protect those people from the coronavirus.
Deanna Davison.
Thank you, Madam Deputy Speaker. Earlier last week, I met with officials from Durham County Council, and part of our discussion turned to council preparations for coronavirus. So can my right honourable friend confirm that he's working with the Department for Housing, Communities and Local Government and with local authorities to ensure that we're fully prepared?
Yes, we're working with all of the local resilience fora and the local authorities that are crucial parts of them.
Daisy Cooper.
Speaker, the Director-General of the World Health Organization has called on all governments to develop all of society and business continuity plans. Could the Minister tell me what he's doing in respect of two particular groups, the street homeless and the staff and volunteers that work in homeless shelters, and secondly, small businesses? Specifically, in a worst-case scenario, would the government, under contingency plans, underwrite the three biggest costs facing small businesses: staff, rent and business rates?
Secretary of State.
Madam Deputy Speaker, the Communities Department is working on and leading on the first, which is very important, and the Treasury is leading on the second.
Dr. Julian Lewis.
Madam Deputy Speaker, does the wearing of gloves on public transport or in other public places make any difference in the dangers of acquiring or transmitting the disease?
I am tempted to give a clinical answer to the right honourable gentleman, but instead I will ask one of the Chief Medical Officer's team to write to him.
Kate Green.
On Friday, I met the Chief Executive of my local council, where 4 cases have been identified. She told me that the council are not able to obtain information from Public Health England about where those 4 individuals are self-isolating. And that is a concern in terms of managing community relations and information. Of course, we appreciate the need to protect patient confidentiality, but will the Secretary of State discuss with his colleagues the need for information to be shared with specific council officials on a need-to-know basis so that they can manage the protection of the whole public?
Yes, absolutely, and there shouldn't be data protection problems here, but sometimes there are perceived to be, and so cracking through those is important as well.
Tobias Elwood. Thank you, Mr Deputy Speaker. Can I echo the concerns about suspending Parliament? Whatever the threats, whatever the challenges that we face in this country, Parliament must continue to do its business and do its duty. He has a responsibility, the government has a responsibility for the people in the UK, but also for those overseas. Could he say how he's working with the MOD on what support they might provide both domestically and internationally in looking after our citizens abroad?
Secretary of State. Yes, I agree with him wholeheartedly on the first point, and on the second point, it's absolutely true that the MOD are working with, alongside DFID and of course the Foreign Office to support Brits overseas.
John Cryer. Thank you, Mr Deputy Speaker. Returning to the issue of statutory sick pay, can the Secretary of State confirm that in all the relevant departments are in agreement that SSP should be paid to self-employed people who are told to self-isolate?
Secretary of State.
We are all in agreement that everybody, including those who are self-employed, should not be penalised for doing the right thing. How you get that support to them is a different question, because because SSP is paid by the employer and the self-employed don't have an employer, but we will be bringing forward a solution to that particular policy conundrum.
Richard Fuller.
Mr. Deputy Speaker, the Grand Princess cruise ship will finally dock in Oakland today, allowing 140 Britons, including at least 4 constituents of mine, to disembark. My right honourable friend mentioned a few messages about what support was being given. A lot of the Brits on that ship feel that the UK has not responded as strongly as the Americans. Can you use the opportunity now to say a little bit more, or perhaps get the Foreign Office to contact constituents on the ship directly?
Well, the Foreign Office will be putting out more information, as they, of course, lead in this area, but we will be repatriating the Brits, and we're working with the Americans to ensure that we can get them home safely. We have full confidence that the American public health system will be able to help those individuals off the ship and onto planes to come home.
Ranger Sharma.
Thank you, Mr. Deputy Speaker. Is the Secretary of State aware that services and advice may not be accessible to those for whom English is not the first language? And will he ensure the government makes instructions and advice available in a range of languages, including Braille?
Secretary of State.
Yes.
Karen Bradley.
Thank you very much, Mr. Deputy Speaker. Members of the Procedure Committee are, like many in this House, concerned about how we make sure that we properly represent our constituents in the event that either members of Parliament or their staff have to self-isolate. We are meeting regularly this week to discuss the changes that might be needed to our procedures in that event. Will my right honourable friend confirm the government will work with us to ensure that all parliamentarians are able to properly represent their constituents?
State.
Yes, it would be a pleasure.
Rachel Reeves.
Thank you very much, Mr. Deputy Speaker. Following up from the question from my honourable friend, the member for Leighton and Wanstead, there are 4.7 million people who are self-employed, and they will not at the moment be entitled to statutory sick pay or contributory job seekers allowance. The company Hermes have already said, working with the GMB, that they will offer support to their workers who can't come to work because they have to self-isolate. Others haven't. What pressure is the government putting on businesses like Uber and Deliveroo and DPD to ensure that people delivering their services will be able to self-isolate?
I would urge all companies, especially the large companies who use an awful lot of self-employed workers to deliver their services, as she said, I would urge them all to look at what Hermes has done and appreciate that it is their part of the national effort to help everybody to make sure that they can go home and stay at home if they need to stay at home to keep themselves and others safe.
Luke Evans.
Thank you, Deputy Speaker. A practical question for the Secretary of State. Many of my colleagues who work in the health service are keen to come forward and do their best. Their big concern is, should schools close, who would care for their children when they run forward to help in the NHS? Is the government considering any plans to support workers who are on the front line?
Well,
Secretary of State.
Absolutely we are, both in terms of any measures that we take, how they might have to be amended for key workers, but also critically, when it comes to the, school closures, one of the reasons that closing schools is not a cost-free option is that it then takes away some of the very staff who we need to be able to respond to this crisis.
Thank you, Mr. Speaker. I have been approached by some parents who want to know what option they may have to withdraw their children from school for a short period, perhaps prior to the Easter break, if they wish to do so, and agree an arrangement with the school for a period of home study. Is the Health Secretary working with his education counterparts on any contingency plan as well, should homeschooling become necessary?
Well, the most important thing here is to follow the advice from Public Health England, and of course we have now well-established routes in place to ensure that all head teachers get the appropriate advice, and ultimately it is head teachers who are currently responsible for these decisions.
Caroline Noakes.
Homeworking is all but impossible in the early years sector, where employers tend to be SMEs and employees tend to be women. I've been contacted by nursery owners in my constituency who are extremely concerned that the advice that they're getting from government helplines is not consistent. So can I please urge the Secretary of State to make sure that information provided to these essential businesses in a crisis is consistent and kept up to date?
Secretary of State.
Yes, absolutely. And if she could bring the individual concerns to my attention, I'd be very happy to look into them.
Ronnie Cowan.
Constituents of Inverclyde, we're expecting 80 visits on cruise ships during the sailing season, which starts in April, including the Regal Princess, which is due in May the 10th. What plans does the UK Government have in place should there be an outbreak on a cruise ship in UK waters?
We are, of course, working with Public Health England on making sure that we have the right answers should this happen. And looking into what happens on cruise ships and advice with respect to people going on future cruises is a critical piece of work that we're undertaking.
Phil Wigan.
Today we had the first acknowledgement that there was a case in Herefordshire, and yet I'm still waiting to hear from the government about the 70 children who are planning to go to northern Italy to ski. Can we make sure that airlines are giving these people, as parents, their money back?
We advise against all but essential travel to northern Italy, and I do not regard skiing as essential.
Eileen Greenwood.
The adult intensive care unit at Nottingham University Hospitals Trust was over 100% capacity on 76 occasions in the last year. An expansion of critical care will add a further 8 beds. What's he doing to expedite this expansion? How many additional intensive care beds does he believe can be created, and how soon?
Yes, we are working very hard right across England, and I know that my Scottish counterparts are working right across Scotland, and Welsh counterparts the same in Wales, to ensure that we get that expansion of critical care beds as much as is possible.
Magnell.
I thank the Secretary of State and his team for their help for all of the patients that have been diagnosed with COVID-19 in the South West. But as he knows, I have a highly rural community. Can he please just elucidate as to how he will be able to provide further action and help for those in rural communities?
This is a very important point, and one of the things that we'll be doing during this period is encouraging as many people for whom it is both clinically and practically possible to, if they need to see their GP or have an outpatient's appointment that is not to do with coronavirus, that they should do that via telemedicine. That's even more important in rural areas and absolutely critical for reducing the amount of infection through GPs.
Karen Smith.
Thank you, Deputy Speaker. Before I entered this place, I worked as an emergency planner for the NHS, and I'd like to pay tribute to my former colleagues, and I'm pleased that the Secretary of State is following their expert advice. Most people, though, won't go into hospital. Most people won't go to their GPs. They'll be supported in the community, and critically, they'll be supported by the wider services of local government and the voluntary sector. So can I ask him to expand really on what conversations is he now having with his counterpart in the Department of Local Government and Communities to support the wider public health and social care provision of local government?
We've got extensive work underway to provide exactly that support, and also through the Office of Civil Society, through volunteers as well. It's very important that we offer the opportunity for people to volunteer in this difficult circumstance, but we've got to do that in a way that the voluntary efforts can then plug in and add to the professional efforts that are, as she says, a great service to this country.
Jane Stevenson.
I was deeply saddened to find out the 4th case has died in my constituency in Wolverhampton North East. Condolences obviously to the victim's family and friends. Our thoughts have to be also with the staff at New Cross Hospital, and I'd like to ask my honourable friend, are there any special advice to be given for those with relatives in New Cross Hospital or staff members attending, because I know people are greatly concerned?
Well, I add my honourable friends to my honourable friends' condolences to the family and the loved ones of the patient who's died at New Cross Hospital. I want to thank the staff at the hospital who've acted in an exemplary way, and also to reassure other patients at the hospital that the steps that are necessary to ensure that the hospital is safe, of course, have been taken, and that her constituents can be confident that her local NHS has risen to this task.
Kevin Brennan.
Thank you, Mr. Deputy Speaker. On the point about people who've booked holidays and cruises and who are perhaps doing the right thing by considering not going on them, even though they're insured, they aren't always covered to do so unless they've been specifically told not to travel to that country. What's the government doing to assist people in that sort of situation?
Well, we constantly keep the travel advice under review. And we've also made COVID-19 a notifiable disease to help. Both of those will help with the circumstances he outlines.
Andrew Griffith.
Thank you, Mr Deputy Speaker. On behalf of those who've already been affected in West Sussex, can I thank all of those who've been working extremely long hours to deal with this crisis. Can I ask him to remind everyone involved that this is a marathon, not a sprint, and that pacing in dealing with any crisis is incredibly important. And can I also urge him to use the innovation capacity and capability of business as we move through this?
Yes, I agree with all of that. This is a marathon, not a sprint, and critically, as the scientists have advised us, getting the timing right for the interventions is crucial for getting the best possible response as a nation.
If everybody continues to be pithy, we will get everybody in. Alison Thewlis.
Thank you very much, Mr Deputy Speaker. Last week I asked him about advice given to DWP decision makers about coronavirus. We were not particularly reassured by the answers given by DWP ministers this morning, and that advice has still not appeared in our inboxes. Can you follow that up, please?
Secretary of State.
Yes.
Felicity Pocock.
My local authority of Kensington and Chelsea has got 8 confirmed cases, the most of any local authority in London. We have a lot of international visitors. My constituents are very concerned that people are continuing to arrive from North Italy and they are only being told to self-isolate if they have symptoms. We all know that the symptoms can often come late. Will my right honourable friend think about testing at the airports or mandatory quarantining?
We are increasing the amount of information that's available at the airports, but the evidence from other countries that have tried temperature testing at the airport, shows that it is not effective, and because it leads to lots of false positives, it can actually be counterproductive to the effort.
Clive Efford.
Industries like the hospitality industry employ people on 0 hours contracts, and I know of one major hotel, that has laid a number of people off. What can the Secretary of State do to ensure that people aren't left in financial difficulties due to their employers taking these decisions?
This is a matter that the Chancellor is considering ahead of the budget.
Jason McCartney.
Thank you, Mr Deputy Speaker. Can I thank my right honourable friend and his team for the way in which they're being guided by the science and the medical advice on this. My constituents in the Colne Valleys and Lindley are very keen to be doing the right thing and their very best to contain this outbreak. What specific advice would the Health Secretary give to my constituents who are organising community events over the Easter period and over the May Day weekend, particularly events that will have a large turnout, a large attendance from those most at risk, the elderly?
Well, we are not currently advising the cancellation of mass events, but we are considering very closely further advice and strengthening advice to those in the vulnerable and elderly groups.
Helen Hayes.
Thank you, Mr Deputy Speaker. King's College Hospital in my constituency has the highest level of debt of any hospital trust in the country, and also has a new 60-bed ICU, which has been much delayed in its opening. Can the Secretary of State confirm what additional resources will be made available to King's to make sure that those beds can open fully staffed and fully equipped as soon as possible, and to make sure that this very challenged NHS Trust has all of the resources it needs to deal with the additional needs presented by coronavirus?
I'm very happy to look into that specific example.
Ed Timson.
Speaker. In May and June, millions of pupils, including Nedesby, will be sitting important public exams. And whilst accepting my right honourable friend is doing the right thing by following the scientific evidence, can I encourage them to do everything possible to make sure those exams go ahead? And in the event that they are chosen not to, that there are clear contingency plans?
Yes, of course. This is a lead for the Education Secretary, but he and the Schools Minister are working very hard on it.
Jim Shannon.
Mr Deputy Speaker, churches in my constituency yesterday took precautions. Those who need to self-isolate are having food supplies delivered and regular phone contact to stave off the feeling of being alone. Does the Minister accept that for a lot of people's mental health and spiritual welfare, the ability for churches to meet for fellowship and prayer is essential? And will he further accept that churches remaining open for as long as possible is as essential as schools remaining open as well?
Yes, I emphatically agree with him, and I should have added, of course, churches and other religious groups to the long list of organisations that can, and I hope will, participate in this national effort so that we as a country can get through this as well as possible.
Karen Bell.
Good communication is obviously key, so firstly can I thank my right honourable friend for his regular updates. Secondly, could I ask him to join me in praising the staff and management at the Royal Stoke University Hospital, who have treated a case recently and have communicated very clearly with the local community in Stoke and in Newcastle-under-Lyme.
Yes, the Royal Stoke and all the staff at the Royal Stoke have done a brilliant job. I worry that they will no doubt have more cases to deal with, but the work they've done so far is something that we should all praise.
Dame Diana Johnson.
Thank you, Mr Deputy Speaker. The Secretary of State has called for the national effort on a number of occasions. I wondered what his take is on the request from the TUC, who've called for a joint emergency task force between trade unions and businesses to make sure, for example, statutory sick pay issues are addressed, as well as keeping public services afloat.
Well, of course, trade unions have got an important role to play here as well, and that's something we absolutely should consider.
Everett.
The Secretary of State is no doubt aware that one of the 4 deaths that he referred to in his statement was an elderly patient with underlying health conditions in Milton Keynes University Hospital. What steps is the Secretary of State taking to ensure that hospitals like Milton Keynes University Hospital and others are open and safe and clean?
Well, all of the hospitals that have so far dealt with cases and indeed the 4 confirmed deaths have got protocols in place to ensure that the hospital remains a safe place to treat everybody else. That, so far, the evidence is, has worked well, but of course we keep working at it.
James Murray.
Mr Deputy Speaker, many care workers are on 0 hours contracts and work for multiple providers. This means they may struggle to prove they are eligible for statutory sick pay, forcing them to choose between protecting their clients and paying their bills. The Secretary of State mentioned statutory sick pay in earlier remarks, so I'd like to ask him, what is he planning to do to help care staff who aren't eligible for statutory sick pay or who might struggle to prove their eligibility?
I'm working very closely with the Welfare Secretary to address this exact point.
Neil O'Brien.
Over the weekend, Leicestershire had its first confirmed case of coronavirus, while a number of European countries moved to ban large public events. Will the Secretary of State explain to the House why the timing of such social distancing measures is so crucial, and at what point and on what basis he will decide if they are necessary?
Well, the first question you must ask is, how effective is this measure? Is it effective? And the second is, are you going to get unintended consequences of people acting differently in a way that actually hinders the overall effort? It's for the scientists best to explain the reason that they have scientifically come to this advice, but it is clear that there are other measures that we can take that are more effective and have fewer negative side effects.
Philip Holloway.
My constituents in Kettering are struggling to understand why we're not banning flights from quarantined areas of North Italy.
The reason is that there are many UK citizens in that area who may want to come home, and also, crucially, and this is very important, the evidence shows that banning flights from affected areas does very little to protect you. Indeed, Italy was the only country in Europe that banned flights from China earlier in the progress of this disease, and it didn't work. And now Italy is the epicentre of the European outbreak.
Stuart Anderson.
Thank you, Mr Deputy Speaker. We've just heard about the death in Wolverhampton, and I've had a lot of constituents talk to me about schools. Is it safe? You've updated the House on this, but there are hundreds of trips planned over the next 3 months all over the UK and Europe. What is the advice around school trips?
The advice around school trips is to follow the Foreign Office travel advice. So as of this weekend, not to take a school trip to North Italy, and otherwise to follow the travel advice.
Will Butler.
Thank you, Mr Deputy Speaker. As a former journalist, I know the temptations of a dramatic headline, but does my right honourable friend agree with me that there is an onus on the media here to report responsibly and not engage in scaremongering?
I strongly agree with that. I would say that largely the media has been responsible, but there have been a couple of exceptions, and I hope that the media play their part in this national effort in reporting the facts and what we are thinking of doing, and especially with the transparency that the government is providing, but do so responsibly and thoughtfully as to the consequences of the way that this virus is portrayed.
Danny Kruger.
Thank you, Mr Deputy Speaker. If large numbers of elderly and vulnerable people have to self-isolate, the statutory system is simply not going to be able to provide them with all the support that they need at home. So can I urge the government to work not just with local authorities but with civil society groups to ensure that people get the social and practical support they need?
I emphatically support this call for civil society groups to play their part in the national effort. The honourable gentleman knows more than most about the work that they do and the work that they can do. And I would be grateful for some of his time to work with him on how we can make sure this is best done.
Thank you very much. Point of order. Mr Chris Bryant.
Thank you, Mr Deputy Speaker. There have been several references already today, including from the Secretary of State, quite rightly, to the House of Commons Commission decisions or meeting that was held earlier on today, I think jointly with the House of Lords Commission as well. There are many of us who have school visits which are meant to be happening to Parliament in the next couple of weeks, who have their international delegations. I think there's one group coming from Croatia next Monday. It would be helpful if there were a means of the Commission updating the House and perhaps being able to answer questions in some way, and I just wonder how that might be achieved.
I thank the honourable member for the point of order. I know that this issue is being discussed on a daily basis, is being taken very seriously, but I also know that right honourable and honourable members do have constituents who come down, some of them travelling very many miles to come here, or indeed delegations coming here as well, and that they will want to be informed as well. I don't sit on the Commission, so I don't know how the deliberations went this morning, but I will make sure that his request is passed on to the Speaker when he gets back. Thank you very much. We now come to presentation of bills.
parliamentlive.tv